So as the spokesperson for Harford County Public Schools, I get the question all the time from employees as to why our healthcare premiums increase. The answer is actually really simple and can be easily described by telling a story. Picture this. You're driving on the road in your brand new expensive car that you saved up for years to purchase. While you're driving along with the top down, wind blowing through your hair, radio blaring, a text message pops into your phone from your sweetie telling you that they will meet you at 5 p.m. for dinner. As you look up from your phone, you see the back end of an old Cutlass Supreme hoopty growing ever closer to the front end of your brand new baby. You have a split second to slam on your brakes, but you are just a few seconds too late and bump into the hoopty in front of you. Thankfully, no one was injured, but there is some minor damage to the bumper of your brand new shiny ride. The hoopty, well, given the current state of the poor old car, you wouldn't even be able to tell if there was damage. After exchanging car insurance information with the dear old granny driving the hoopty, do you A, call the most expensive body shop in town to have the bumper fixed right away? Money is no object for your new vehicle. B, leave the dent. It gives the car character anyway. C, call your car insurance company and request comparison quotes from body shops that will provide excellent service and work while keeping the cost reasonable. And D, spray paint the dent, move on with life. I'm certain that most of you probably pick C. Our health insurance operates very much the same way. HCPS is self-insured, which means that HCPS, and by extension our employees, own our health insurance plans, and employee actions have a direct impact on the rates. Rates are based on the actual claims usage of HCPS employees, which is projected forward to adjust for healthcare inflation, fixed expenses, administrative costs, and reinsurance premiums, are added to the projected claims to calculate the rates. If HCPS claims plus fixed expenses total less than the premiums paid, that money comes back to HCPS, which helps hold down future employee premiums. If HCPS claims plus fixed expenses total more than the premiums paid, HCPS must pay a margin back to Care First, resulting in higher premiums the next year. So let's take that same story of your new car and focus the story on your health. You're experiencing back pain from the exercise program that you recently started. You jumped right in and started with 5-mile runs and wind sprints because, hey, when you were 25, you could run marathons. Well, realizing that your body just won't do what it used to, and you've been experiencing this pain for a couple of weeks now, you just can't take it anymore. It's starting to interfere with your ability to coach your child's basketball team. Do you A, call the orthopedic specialist immediately? You need to get this corrected right away. You don't care about the expense. Insurance will cover it anyway. B, see your primary care physician for your back pain first, as they can treat many illnesses and injuries at a lower fee and will consider your overall health, not just your back pain. C, suck it up. You're tougher than the pain in your back. You can keep going because you're tougher than nails. D, have your 8-year-old walk on your back. It may crack and you can move on with life. I'm hoping that most of you answered B. A primary care physician can assess your overall health while keeping claim costs down, resulting in lower premiums for everyone. Just as you wouldn't immediately send your brand new car to the most expensive body shop in town because we all know once you make that claim, your car insurance provider will jack up your premiums, that is also true with our healthcare insurance. We can make smart decisions to help control the cost of our healthcare and promote our well-being. Here are a few tips to keep costs down and stay well. First, maintain a healthy lifestyle. The healthier you are, the less likely you will need costly healthcare services, which means you spend less out of your pocket on copays, deductibles, and other medical costs. 2. Get regular checkups. 3. Save the emergency room for emergencies. Emergency room visits are 2 to 3 times more expensive than a visit to the doctor's office or an urgent care center. Not to mention, ER visits can be unnecessarily stressful and time-consuming. 4. Ask questions. Most people are not accustomed to questioning their doctors about the insurance plans they accept or the cost and medical necessity of a treatment. Asking questions of your healthcare providers helps maintain both the cost and quality of your healthcare. 5. Get regular screenings. 6. Visit a primary care physician before going to see a specialist. 7. Ask for generic. Generics have the same chemical equivalency as brand name drugs and are held to the same standards by the Food and Drug Administration, but they cost less than brand name drugs. And finally, review your bills. This will help you identify and prevent unnecessary healthcare costs. The largest share of any school district's budget goes to pay for employee wage and benefits. In Harford County, approximately 83 cents on every dollar goes to wages and benefits. From 2002 to 2012, HCPS saw a 200% increase in healthcare costs. That's more than $43 million. According to Care First, the greatest contributor to healthcare costs in the U.S. is lifestyle choices, accounting for 70% of premature deaths and major illnesses. Shocking, isn't it? Not genetics or heredity, but lifestyle choices. I was shocked to hear that myself. Did you know the Board of Education created a Benefits Advisory Committee? The committee is made up of representatives from the board, the 5 employee bargaining units, and the Retired Employees Association to maintain quality and affordable benefits. It's true, the members of this committee meet regularly to discuss cost-saving strategies, represent the needs of our employees by advising the board on potential changes to our health care plans, and brainstorm ideas for helping to educate our staff on the many benefits we are afforded as employees of Harford County Public Schools. It's open enrollment season. As you select your benefits for the upcoming school year with health care insurance in the forefront of your mind, please keep in mind some of the strategies we discussed. And as always, you can call or email our benefits department with any questions that you may have. Thanks for listening, and on behalf of the HCPS Benefits Advisory Committee, take care and stay well.